I'm going to turn the floor to Dr. Zhang, who is, as I introduced, is the head of infectious diseases at the Fudan University Hospital, but is also intimately involved in devising the megacity defense system. At the outset of this outbreak, most optimistic projected that Shanghai, of 30 million people, would have a minimum of 80,000 infections to as high as perhaps 800,000 cases. But the result is, through very carefully devised a plan and strict implementation, as of today, there are only slight over 300 cases and only 2 deaths. And so Dr. Zhang is going to share with how that is accomplished. The floor is yours.
Okay. Okay. Thank you, Dr. Lilu, and I'm very glad to share our experience in a big city like Shanghai with 30 million people, and when we have lots of import cases from Wuhan. So, next slide. Yeah. So here is a slide that we can see the curve that representative of all the cases from Wuhan. We can see here, after the lockdown of Wuhan, still there's some cases of Wuhan imported to Shanghai. And after that, maybe the first case in Shanghai, we can see here is almost the same case in United States at January 20th. And after that, the lockdown date of Wuhan is January 23. And after that, there's some people from Wuhan enter Shanghai. And Shanghai, we take the top level response to the major public health emergency. So as the paper published in the Lancet that predicted that there maybe there's almost 800,000 cases will happen in Shanghai. But after the very strict measures taken by Shanghai and by the Shanghai government and all the Shanghai people, actually up to now, we have 350. So therefore, today I just want to share some experience, what we have done in our hospital. And if we have some improved cases, what we will do in our patient clinic and what we have done in our ICU. Next slide. So this is the curve I just mentioned about the paper. This is a paper we pre-published in the internet about the epidemic trend of Shanghai. We can see here, here is the 3 curves. The highest curve is the predicted cases about the epidemic trend prediction of Shanghai by one study published in Lancet, that it was predicted maybe there were 800,000 cases will be happening in our city, with the city big city with 30 million people. So the second curve is about this is a conserved prediction about the predicted cases in Shanghai, maybe 80,000 cases, 80,000 cases in Shanghai. But actually, lastly, we can see that only 350 cases in our city. So actually, we just want to share some experience, what we have done in our hospital and all the hospitals in Shanghai to stop the transmission of the cases among the peoples among the populations in Shanghai, and also we stop the transmission of the disease in our hospitals. Next slide. So actually, we take lots of measures by the government and also by our colleagues in hospitals in the very early stage of the epidemics. The population traveling or to live in Shanghai has significantly decreased by approximately 50% after we take the very top response to the public health emergency. And all gathering activities and most of the recreational sites, including restaurants, theaters, and etc., were closed during the first several weeks after we take the emergency. So Shanghai extended the Spring Festival holidays to 17 days from January 24th until February 9th to minimize the possible infections from patients in their incubation period. So all citizens were encouraged to stay at home unless for unnecessary working, shopping, or medical treatment. So actually, in the very early stage of the epidemics, all the city slowed down. During the 2 weeks of the first stage of these epidemics, actually, so all the population in Shanghai slowed down, stay at home, and all the hospitals now work for finding the cases and quarantining the cases. This is what we have done in our city. So next slide. So, we can see what we have done in our city about all the measures we take in the medical and the health control of the disease. Shanghai, this city, we opened 110 designated fever clinics. So all the designated fever clinics was published in the internet for all the population in Shanghai. If they have fever or any symptoms related with the disease, they can find the nearest site for the checking and diagnosing the disease. All the patients who met one epidemiological criteria in the very early stage, we just think that if the person came from Wuhan, we can see that this is the epidemiological criteria matched. And if the patient has one other clinical relevant symptoms, just like
What happened? Dr. Zhang, we lost you.
His mic dropped off.
Dr. Zhang? The mic dropped off.
It's a pity that we are in China.
Is it coming back?
He's coming back. Yeah.
Okay.
Yes.
Dr. Zhang, you're coming back?
Yes.
Oh,
I'm
good.
back.
Okay, continue.
Okay, please one slide back. Go back. One slide. Go back. Yeah. Yes, we can see here. So if the physicians in our hospitals, we thought the patient who met one epidemiology criteria plus one clinical relevant symptoms, we can think the patient meet the criteria of suspected case, and the patient would be admitted to the quarantine ward, and the CDC staff would come for sampling and do the epidemiological question. So if the nucleic acid test turn out the positive, all the patients were enrolled into the designated hospital in Shanghai. So in Shanghai, we aggregate all the medical force in one designated hospital in outside of the city. So actually, I am the chairman of the expert committee. I always stay in the designated hospital for almost 2 months. So recently, we almost cured 95% of the patients. Now still we have 5 patients who are very critical air, now still stay in the hospitals. So next slide. So this is the case. So what one of the hospital in Shanghai. This is the Huashan Hospital in Shanghai, a very big hospital with almost 2,000 beds in this hospital. These hospitals, I am the head of the ID department of these hospitals. So I just give the case about how to do the screening the cases in the in a comprehensive hospital with a lot of beds. We can see here, this is the COVID positive cases so in these hospitals on for the suspected cases, totally 53 in these hospitals. We can find that in all the suspected cases, 20 cases were COVID-19 positive, and COVID-19 negative cases we can see here in totally the 33. So we can see here some symptoms including the fever, dry cough, diarrhea, fatigue, headache, vomiting, and anything else. Of course, there's something also neutrophil count very low, and leukemia also we can see in these patients. Next slide. So I just want to introduce what we have done for the diagnosis of this disease. We actually, in the comprehensive hospital, we will use all we can do for the patient. We do the chest CT, the virus RT-PCR, and meanwhile, we will do the multiplex PCR to screen out the flu and the other virus during the COVID epidemic stage. We can see here in the laboratory confirmed cases here, we can see here, if we use the CT scan, of course, the sensitive rate is very high. But however, if we do the PCR, actually the sensitivity is not so high. But actually, only 70% of the people, if they do the first time to do the PCR, the positive rate, the sensitive rate is only 70%. But if we do the second time for the people with the PCR, we can find the remaining negative patients. It can be ruled out. Just we can find out. We can increase the sensitivity. So if the patient was highly suspected of the COVID disease, we will do the next generation sequencing for the patient. We can see here, if we do the next generation sequencing, we can find all the patients out. So therefore, in all the patients we screen in our hospital, we can find that the sensitivity of the real-time PCR sometimes are not so sensitive as 100% percentage. If we do more, we can find all the patients out. So therefore, we can find there's some co-infection cure within these confirmed cases. Next slide. So we can see here there's some graph about the left the circle is representative of the non-COVID cases. We can see here. Here is the suspected cases, and we can see here there's a lot of other virus associated with the same symptoms. We can see there's some the ISV virus and the mycoplasma and the EB virus and the HMVP and unknown other pathogens. So we can see the right side. We can see the circle here. In all the COVID cases, we can see here there's some co-infections. So in all the 20 cases confirmed of the COVID, we can see here half of them there's only one pathogen, the COVID, the SARS, the coronavirus. But in the remaining 11 COVID cases, we can find there's some co-infections, including the influenza, Haemophilus pneumoniae influenza, and also the flu and the respiratory, the ISV and the Candida, and all other the rhinovirus. So we can see here, if we just take the multiplex PCR, if sometimes we can find it is caused by the flu, but if we, during the epidemic stage, actually, if the patient has the epidemiology clue, actually we can find that some of the patients, there are co-infections. Therefore, for the patient who is positive for flu, I think it's not enough to rule out the coronavirus. Why we are so afraid of the coronavirus in our hospital? Because we are afraid of the hospital-acquired infection. We are afraid of the transmission in our hospitals. Next slide. So how about if we just take the CT scan as the criteria for diagnosing the disease? We think that's not enough. We can see here the upline. We can see here there's some CT scans. All these cases are caused by the COVID. But the lower line we can see here is caused by other pathogens. We can see here some the CT scan sometimes there's some similar with the COVID disease, especially if the patient with the very mild symptoms. I think the CT scan sometimes is very similar. Of course, in the very critically ill patient, the COVID, there's the characterization of the disease is very obvious to discriminate the COVID with other disease. But if in the very mild disease, I think it's not so obviously to discriminate the COVID with other disease. Just like we can see here, RSV infection, mycoplasma, parainfluenza virus. This is a lower line CT scan. So I think it's not enough if we just take the chest CT alone to rule out the disease. Okay, next. So in our hospitals, this is we can see here. This is a flow chart. This is a flow diagram we can see here. If we have the suspected COVID patients, we will collect the respiratory specimens immediately, and then we go to the PCR for the first time SARS-CoV coronavirus, and then meanwhile we will do the PCR for other pathogens, including the flu and the RSV and all other pathogens together. So if it's positive for COVID, I think we can give the confirmed diagnosis for the patient. But if the specimen is negative, however, we think the case is highly suspected of the disease, we will do the second time the SARS coronavirus for the patient. Next slide. So after that, if the second time the SARS coronavirus PCR, if the positive, of course, we can give the confirmed diagnosis for the patient. But if negative, if still we were clinically highly suspected of the disease, we will do the repeated sampling PCR, differentiated sampling site. Also, we will do the next generation sequencing. Meanwhile, we will ask the national certified third-party agency to do the PCR. Then, if we have this flow actually in our Hwasong hospitals, we find all the cases imported in these hospitals. Totally 10 cases during this epidemic stage. But in Shanghai, we have lots of similar hospitals in this city. So every big hospital like our hospital, if we take some similar flow diagram, they can find all the cases they can, and no cases that we missed, and will give the transmission in the community. So next slide. Next slide. So here we can see here how about the speed from the first the first time the patient sees a doctor and the admission. So we can see the time. So because of the timely diagnosis, we will do the very timely admission because the patients to prevent the further local transmission. The left side is the picture. This is the incubation period of all the patients in Shanghai, we can find the incubation period in Shanghai almost 7 days. So before during this incubation time, we can find that there's the risk of the transmission. Therefore, what we will do for all the patients is just we will just shorten the time for the patient stay outside the hospital. We just want to shorten the time to do the admission to the hospital and prevent the further local transmission. So now in our city, mean onset admission interval was almost 5.5 days. So I think it's very short in Shanghai, and we stop the transmission for the patients. Okay, next slide. So the key points of the medical and the health control in Shanghai and China, I think is very similar. All the suspected patients should be tested at least twice by CDC. All nuclear tests and the treatment are free. All diagnosed patients should be admitted to the designated hospital. We just want to stop the transmission during the hospital in other hospitals. So in Shanghai, we just have one designated hospital. So it's very easy for us to manage all the patients and to stop the transmission of the patients in the hospitals. All the close contacts of the diagnosed patients were traced and quarantined for 14 days. So all close contacts of the diagnosed patients received the PCR test to rule out the real case. Next slide. So we can see here, this graph is a little complicated, but actually we can find all the cases in Shanghai. Here we can see the red bar stands for all the cases imported. The green bar here, we can see here, these are all the cases that happened in the community. So just means that the local cases. So here we can find it here in Shanghai during the 2 months after the lockdown of Wuhan. We can see here all the cases we found in Shanghai, most of them just the import cases. The community transmitted, the local case, the green bar, is not so high. Therefore, we stop the local circulation of the disease. I think this is the most important strategy that we can take. The very quick detection of the case and very quick to quarantine the case and quarantine and trace the house contacts, and then we stop the circulation of the disease during our community. As on the other side, we can see next slides. Here, in next slides. Next slide. Here, we just is the. Please go back. Here, this graph is a picture about epidemiology. What happened in Italy? We just as a comparison. We can see here that Italy now all the population in Italy now is 60 million in the whole country. So just twice the whole population in Shanghai. We can find here the red bar, only red bar. You even cannot see the other very low bar, because in Italy, after the first several cases transmitted from China, but later we can see here all the other cases in Italy now the local cases are not the imported cases. So I think the key to stop the disease spreading is very, very important. If there's a lot of local cases, actually we cannot stop the transmission further. So this is what I think is the most important experience in our city. If we want to stop the transmission, we will decrease the increasing cases and make the curve not so sharp. I think the only way that we can do is to do the good diagnosis, very quick diagnosis. I think it's very, very important. Okay, next slide. So here is a control of the transmission. We can see here there's some curve. The first curve, the very highest curve is about the Hubei province, the Wuhan province. the real curve. So outbreak and lots of transmission during the population, during the community, and lastly, and we can find out almost there are 100, almost 100,000 the patients in lastly. So we can see another curve, the red curve is about Italy. So we can see here that Italy now the curve is almost increase very high. The lowest curve is Shanghai. We up to now we still keep the 300 cases. So therefore, I think if we do not do the very quick and immediate diagnosis for the patient, if the patient stay outside of hospitals for very long duration, actually the outbreak in the community, it cannot be avoided. So lastly, I think there should be a lot of cases. Of course, during all the among all the large populations infected with disease, actually 10% or the 20% will be very severe. If the hospital is not enough, the beds is not enough for the severe cases, I think it's very dangerous. Now next slide. So this slide is the death cases. So the curve of the Wuhan we can see here is very high. Is the first curve, the very highest curve. The second curve now is Italy. So recently the death rate, the death cases in Italy is very high. I think this is because of lots of very severe cases now was found because in the lots of population infected with the patients. So actually I am afraid that if there are lots of cases infected with this disease, we cannot stop the transmission. And lastly, in the end, we will find lots of severe cases. So I think we will not have very enough ICU beds for help these cases. So the lowest curve is Shanghai. Actually, lastly in Shanghai, we just have 30 cases very severe. And up to now, we only have 5 cases now still remaining in our hospital. Oh, that's a slide. Okay. That's a slide. Okay, I will give some conclusions. So according to our experience, we will find that there's some supporting reasons for Shanghai management. If not controlled at a very early stage, I think the medical resources, especially the ICU resources, might in the end face severe shortage and causing sharp rising of mortality rate. The percentage of severe cases of COVID in China now almost around 10 to 20%. In Wuhan city, without effective control in the very early stage, we can see that there are 5,000 critically ill patients right now in Wuhan. Right now, we still have 5,000 in this city. So it's a very huge disease burden. Now, on the contrary, only 5 critically ill patients in Shanghai today. So I think that if we give the early stage control of the disease, we will have the brilliant future. Okay, next slide. So, however, if the pandemic is failed to be controlled globally, how will we cope with the COVID? I think this is still a question. Management is similar to that of the seasonal flu. I think maybe that's not so similar. So when was the vaccine come out? I don't know. How to balance between the epidemic control to avoid the medical or especially the ICU resources shortage and the social vitality. So it's really very difficult to give the balance. In the end, each country and every state should adapt to its own suitable methods. Okay, this is all the experience I share with you. Thank you very much.
Thank you, Dr. Zhang. There is a real good reason why you are called the gatekeeper of Shanghai. The experiences of Shanghai and the experiences of Wuhan offers 2 starkly contrasting experiences about how public health policy response would lead to dramatically different results. The death rate in Shanghai and compared with Wuhan, there's about 10 times difference. By the way, the rest of the country outside of Hubei province have a very similar experiences as Shanghai. Beijing and the rest of the other megacities, Guangdong, Zhejiang, all had very, very similar experiences. And so what we discussed here in Shanghai is not alone. It complied to the rest of the country outside Hubei. And now, unfortunately, the Italian experiences are following very closely to that of the Wuhan city. The death rate is now above 5%, I think it's 6-7% approaching. And we don't see any signs of abating. It's worth noting that all 3 doctors are still working on the front line, and they took their valuable time from their rest to be with us. It's now about 11, 12 o'clock over there in China, and they've been seeing patients the whole day already. And all 3 have took care and time to really put presentation in English to make it easy for our audience. So on behalf of everybody, we still have several hundred doctors online. I want to express our deep, heartfelt thanks to all of you, and particularly for what you have contributed to the collective knowledge about this virus and to what you have done to protect the people over there. We hope all the experiences you shared here would help us as we're embracing a battle to protect our people here. And as we can see that in this virus, we have now found a real worthy adversary. It is at least 10 times more lethal than flu, and it is more clever in the sense it is both fatal as well as infectious. And at the same time, it attacks both the lung, such as SARS, but also it severely damaged our immune system, the same way that HIV does. This could really be with us for a while. We have received numerous questions that cover from general topics as well as a specific technical in nature. What we will do is to organize all of the questions and send it to the 3 doctors. And we will have our team to have separate interviews with all 3 doctors, record their answers and disseminate it both in video recording, audio recording, as well as text to all of the people who wish to receive them. And please do write to us at himalaya@hemcap.com. If we have learned anything from Chinese experiences, it seems to me has boiled down to 3 broad categories. Number 1, aggressive testing, aggressive tracking, to track down every single one get infected, using either technology or strong administrative measures, so that we have a real sense of who they are, where they're located, and therefore to prepare where the inevitable outbreak is going to be. Number 2, to differentiate a treatment of people who are in danger of being infected, who are infected, who have mild syndrome, and who have severe or critical symptoms. To have a differentiated treatment of all of them, from quarantine, home, to shelter, using gymnasium, sports stadiums, hotels, etc., to a hospital bed and critical care. Number 3, to have robust reserve for the critical care hospital bed. That in early days of Wuhan, that is ill prepared, which resulted in a large number of deaths, which now we see a repeat in Italy. Pretty soon, China has mobilized resources from all over the China to really send to Wuhan. Altogether, 42,000 doctors and nurses from all over China were sent to Wuhan to fortress the defense. And Dr. Zhang is a fine example of all those people who have been stationed there since 2 months ago. And So to really achieve where they are is not easy. It may not be repeated in other countries, depends on the social structures of different culture and different society. But I think the experiences that China has been through is extremely valuable to all of us here. Unfortunately, due to all sorts of different reasons, ideological, etc., that those 2 months of experiences, valuable experiences, are largely lost in America and in the West broadly. Unfortunately, virus does not understand the differences, does not understand the term trade wars. It doesn't recognize borders. It really goes wherever they want to survive. And so we're all in it together. And so we will continue as long as people find it valuable to share those experiences and learnings out of this enormous fight that China has put together. And all those tremendous work done, represented by those 3 great hero doctors in my own mind and in the mind of a lot of people. And so we will continue to do that. Now it's about an hour and a half now, so we're coming to the end. A lot of people might have other plans, but I assure you that I will put everything in video, audio, text format and disseminate it to all of you if you wish to receive them. And we will follow up with all the answers and record all the answers for the questions that have been posed to us from the 3 doctors with their permission. And again, distribute it back. And here I want to recognize lots of the volunteers that have really made this available. From the very beginning of the Wuhan outbreak, we have organized a volunteer group, 2020 Helping Wuhan. And about a week ago, we have formed another volunteer group called 2020 Helping Seattle, broadly United States. And many people have played a critical roles in there. I won't recognize one by one, except that together now we have resources that covers many different fields to make sure at the beginning to disseminate those vital learnings and experiences into the United States as fast as possible. I will come and invite everyone who want to join the effort to come together. Together, let's really do the best we can to protect our community, our family, our cities, our state, and our country. For that, I want to thank everyone again for participating, for what you have done, for what you have contributed. And I thank everybody. We have several hundred people from all over the country, from all the important institutions, medical hospitals, medical schools, that together we truly represent the best of hope for our country. And we would love to help and work together in the days and the weeks to come. So thank you, and we'll resume soon. Bye-bye.